Due to Brazil's immense size, and in the face of uneasy relationships with the far-right federal government, state governments are taking individual actions to guarantee that people have access to COVID-19 vaccines, while the federal government has abandoned multilateral organizations that are fighting the pandemic. Interest in developing and testing vaccines against the novel coronavirus in Brazil continues to rise, as the nation represents a market of over 200 million people and has recorded over 3.5 million cases of the disease.
After every announcement that the vaccine will be available, be it in October, December, January, it leads to a surge in the stock market. There is an intense dispute between public laboratories and private institutes for public funds to develop the vaccine.
Brazil's local governments have not all bent to the ideological postures of the Bolsonaro administration. The recently announced Russian and Chinese vaccines were chosen by authorities who often fall in line with the federal government, while the state of Sao Paulo opted for an agreement between the Butantan Institute and the Chinese lab Sinovac. In Paraná, TechPar laboratories will work with Russia to produce the Sputnik V vaccine. In Rio de Janeiro, the Fiocruz Institute will coordinate with Oxford University in the UK, while US conglomerates Pfizer and Johnson & Johnson announced they will work directly with the Bolsonaro administration. Brazil's health system has been successful in distributing vaccines around the world for the past 50 years, but it now faces unparalleled global demand, which will require mass production of everything from bottles and caps to needles for billions of people.
Never before have we had such a globalized economy and such fragmented production chains, which are unable to connect and serve a common interest. That is the irony of globalization, a globalized world that prioritizes corporate and non-humanitarian interests.
The imminent arrival of a vaccine also raises concerns about how the president will move forward with his already damaging position against preventive measures and economic aid.
There is a great risk that after developing a vaccine, preventive measures will be completely undone. This should only be done after all citizens have been vaccinated, which will take time. The last time the world developed a vaccine quickly, it took 4 years.
Taking into account the never-before-seen speed at which these vaccines are being developed and the way the market has evolved so that pharmaceutical companies no longer work for the well-being of citizens, but to comply with stockholders' demands, can a new pandemic surge in the short term?
Instead of prevention policies that address causes and strengthens our immune systems, we are in a race that is more concerned with the interests of these transnational corporations in charge of the vaccines.
Over the past 2 months, Brazil has been registering an average of 7,000 deaths per week due to COVID-19. The urgent need for a vaccine now comes hand in hand with a geopolitical dispute that seeks to separate humanitarian interests from those of corporations, which see profit from both the disease and the cure.